Research shows that more than half of women experience menstruate period pain, dysmenorrhea, for 1 to 2 days each month. Even though period pain can mean headaches or general discomfort, the pain is typically caused by menstrual cramps. Menstrual cramps occur when your uterus contracts to shed the uterine lining. This can cause pain in your stomach, lower back, groin or upper thighs. This video will go over ways to relieve menstrual cramps. 1. Chamomile tea. Drinking chamomile tea can help in reducing cramps when you menstruate. This is due to the fact that it has plenty of anti-inflammatory compounds that prevent prostaglandins. Prostaglandins are made by cells in the endometrium of the womb. These cells release prostaglandins during a female's cycle, prompting contraction of the womb, pain, and aches. Prostaglandins in the bloodstream are responsible for nausea, throwing up, diarrhea, as well as frustration throughout the menstrual period. NSAIDs like naproxen as well as Advil reduce prostaglandin manufacturing. Sipping chamomile tea prevents pain causing prostaglandins and boosts menstrual circulation to relieve period signs. 2. Hydrate. Menstrual aches, or main dysmenorrhea, are an unpleasant part of life for several women on a month-to-month basis. Consuming more water might help relieve bloating. Get in the practice of drinking 6 to 8 glasses of water each day, especially throughout your period. Add some mint or a lemon wedge to make it extra tasty. Limiting salt intake can help with reducing fluid retention and bloating. Avoid alcohol, which promotes dehydration. Some females experience diarrhea or throwing up in conjunction with menstruation aches. It is very important to replace lost fluids by drinking plenty of water. Easy ways to obtain more fluids. If you don't like the taste of ordinary water, there are many things you can do to boost liquid intake. Begin the day by drinking a glass of fruit-infused water the first thing after you get up in the morning. Sip on chamomile or ginger tea. Drink flavorful mineral water for a new twist on hydration. Make a bottle of cucumber, mint, or lemon water to consume alcohol throughout the day for a spa-like treat. Drink a cup of reduced salt broth to boost your liquid consumption. Remaining well hydrated isn't just great for cramps, it's good for your general wellness. 3. Eat to decrease pain. Diet is key during the time of the month you may desire fatty, sugary, or salted foods. However, these foods are not your buddies. Females normally find that eating the best kinds of foods might help relieve menstrual discomfort. Anti-inflammatory foods like cherries, blueberries, squash, tomatoes, as well as bell peppers are good selections. Cold water fish that is high in omega-3 fats are likewise healthy options. Consume much more calcium-rich beans, almonds, and also dark leafy greens. These foods have substances that reduce swelling. Some women report that eating this way can assist alleviate menstrual pain and boost health. It's ideal to eat a healthy, well-balanced diet all year round, not just for a couple of days a month during your period. Prevent these. Your nutritional as well as way of life behaviors can impact the period aches. If you experience regular monthly menstrual discomfort, some women discover it useful to avoid particular foods. Reduce white, refined foods consisting of sugar, bread, and pasta. Keep away from trans fatty acids that are located usually in commercially prepared foods like French fries, cookies, onion rings, biscuits. Ditch alcohol, tobacco, as well as caffeine. Every one of these things boosts swelling and also may urge period pain. 4. Fennel. In one study, about 80% of young women who took pills consisting of 30 mg of fennel extract 4 times a day for 3 days prior to the begin of their menstrual duration experienced less discomfort than those that took a sugar pill. Scientists think fennel inhibits uterine tightenings that are stimulated by prostaglandins. Fennel remove may be an excellent alternative for the about 10% of females who cannot do their regular tasks for 1 to 3 days throughout their periods due to severe menstrual aches. 5. Cinnamon. In a study of young women, those that took pills having 420 mg of cinnamon 3 times a day for the first 3 days of their menstrual cycle had much less menstruation bleeding, much less discomfort, as well as reductions in nausea and also regularity of throwing up compared to those that took a placebo. The females didn't report any type of adverse effects associated with taking cinnamon pills. Try a sprinkle of cinnamon on your grain or cup of warm cocoa. It can't hurt as well as it may aid your cramps as well as various other period symptoms. 6. Ginger. A research of young females discovered that pills containing help to relieve the symptoms of period pains. Females in the ginger group took 250 mg pills of ginger 4 times a day for the very first 3 days of the durations. Females in the mefenamic acid team took 250 mg pills 4 times each day, while those in the ibuprofen team took 400 mg each day 4 times per day. Ladies in each of the 3 therapy groups reported similar pain relief, satisfaction with treatment, as well as reductions in seriousness of dysmenorrhea despite which treatment they took. None of the women in the research study reported serious negative effects with any kind of treatment. Trying ginger could be an alternative to drug period pain relief. 7. Dill. Researchers checked the effectiveness of dill powder versus mefenamic acid, an NSAID, for the treatment of menstruation cramps in a group of young female trainees. Women were separated into 3 groups: the dill team, the mefenamic acid team, and also the sugar pill group. Ladies started 5 days of therapy beginning from 2 days before the start of their menstrual periods. Scientists located that dill powder happy menstrual pain as well as over-the-counter pain medication. If you wish to try a non-drug treatment for menstrual pain, dill might be right for you. 8. Fish oil and vitamin B1. Scientists researched the effects of vitamin B1 and also fish oil on dysmenorrhea signs in high school students. The girls were divided into 4 various teams. One team took 100 mg of vitamin B1 daily. Another took 500 mg of fish oil daily. One group took a mix of both vitamin B1 and fish oil daily. The last team took a sugar pill. The women took the treatment at the start of their menstruations as well as proceeded for 2 months. Unlike to those in the sugar pill group, those that took vitamin B1, fish oil, or both reported significantly less discomfort. The women that took fish oil or B1 additionally reported their pain didn't last as lengthy compared to those in the sugar pill team. 9. Calcium. Calcium is a nutrient that everybody requires, but many women don't obtain sufficient. We need calcium not just for healthy and balanced bones, but for proper feature of the heart, muscles, and nervous system. Sufficient calcium intake may additionally assist ease menstruation aches. In a research of girls, those who took a supplement having 1000 mg of calcium per day beginning on day 15 of their menstrual cycle up until menstrual pain dropped in the following cycle experienced less extreme menstruation pain than those that took a sugar pill. Load up on low-fat milk products, fortified orange juice, tinned sardines and salmon, as well as other calcium-rich foods to get your day-to-day fill of this essential mineral. Apply heat. Applying a hot pad, warm cover, or hot water bottle to your abdominal area works marvels for relieving menstrual aches. You can locate these products in the drugstore or online. The continual application of warm may work in addition to ibuprofen for the relief of dysmenorrhea pain. Warm aids muscles relax. One study of ladies in between the ages of 18 and 30 that had main dysmenorrhea located that those that applied a warm patch that heated up to 104 levels Fahrenheit experienced similar discomfort relief gain from the patch as those who relied on ibuprofen for pains. If you don't have a heating pad, heat wrap, hot water bottle, or heat patch convenient, a hot shower or warm towel can be utilized rather. Finally, point. Seek medical guidance. If the natural remedy as well as various other treatments are not nearly enough to control your signs and symptoms, it is time to check out the physician. Your physician can check your hormone levels and might prescribe contraceptive pill or other medicines to deal with dysmenorrhea. Let your medical professional find out about your symptoms, specifically exactly how they add to rest loss or interfere with day-to-day functioning. Having a complete picture concerning your medical history will certainly aid your doctor think of the very best therapy for you. Obtaining an annual checkup is a great idea for every person. Thank you for watching.